Hi guys, this is Corey Durbin, President of Shared Health Alliance. I appreciate you joining us today and taking a few minutes. Got a really great concept here that we've put together that is working absolutely great for some large group opportunities, and I think it'll open some doors for you as we get here toward the end of as we start to approach fourth quarter and first of the year. So I won't take a long time. I want to be respectful of your time, but I want to instill this concept a little bit and plant the seed, and hopefully you'll reach out to us and it'll open some doors for you. So going to talk to you about our SHARx program, what we call our SHARx program, which is the Shared Health Alliance RX Prescription Cost Reduction Program. And what we're going to do through this program is save clients and prospects huge dollars. What you're going to be able to show them with this concept of savings that it generates on the RX side will be absolutely phenomenal. We've got a proven track record with this. It will help you win business. It will help you retain business where you've got competition this year on a large group, and also will help you create new revenue on in-force business and revenue even if you don't capture the whole medical business on a large group. So let me show you what we've got going here. This is an aggregate report. Hopefully you've looked at an aggregate report before, but the bottom line is this is a claims report for a self-funded case. It's a sample, one of our groups. If you look at the column that is highlighted, the RX column, that details the actual RX, the prescription spend that this particular client had. In this illustration, they had spent $347,630.97 on their prescription cost. That was over this 12-month period. That is the number we're focused on. How do we impact those dollars? So we're going to show you that, and what we're telling you is I can remove 60 to 80% of that claim cost out of the employer's spend and still give the employees the access to the prescriptions. That's the key here. So when we send a proposal back to you, here's what we're going to focus on. This particular group, if you look on the right-hand side at the top, had 803 total employees on the medical plan. The estimated prior year savings total was $739,909. I'm not kidding you. We're just walking into this employer having done some data analytics and said we can save you about $740,000. We looked at all the brand name and specialty drugs that this particular client's employees were using, and they were spending $1,063,404. The program creates no access fee for the employees. There may be some copay associated with access to the drugs, but there is no access fee the way we set up this program as a control group in the advocacy program. We anticipated an 80% fill rate. I will tell you that we actually think we can fill 90, and we assumed 80. So we've got a conservative estimate of 80. Even if you use 70 or 60 guys, the numbers are phenomenal. But 80% is a very realistic expectation. The total annual cost, given the fees and the structure that we built with this particular broker, was a total of $110,814. The annual cost of the program was $11.50 times the 803 people, so $9,200 a month was a total of $110,000. The net savings when we took the $850,000 minus the $110,000 in expenses was $739,000. So how do we do it? We're going to eliminate, we say 50 to 70% on the left side of this page. It could be 60 to 80 or more. And we ask the employer to use our advocacy program as the initial point of access into the prescription program for its employees. We exclude specialty medications from the medical plan. We'll get into this in detail, but the reason we do that, when we get a declination letter from the pharmacy benefit management company, then we're able to access these prescriptions through direct from manufacturer programs and grant programs, and it happens a whole lot easier if we've got a decline letter. We cap the access point at the pharmacy, so point of service prescriptions are limited to under $350. So again, it generates a decline letter on drugs over $350. We utilize our PBM so that we can effectively communicate the program. We will not disrupt access to the members. You've got to understand, we know that's a key. We're not going to create a situation where the employees go without access. We'll educate the employees on what to do when they receive the notification of decline from SHARx and how to get into the program. We give them time to do it. We'll go into that in detail with you. I don't want to take more time than necessary today, but we'll do an override so they can get the drug at the pharmacy long enough to get the advocacy approach going. Help train the employees to use the SHARx web link for the initial access point for high-cost medications. Understand there's a learning curve involved, but we're going to get out of the head of the curve. If you give us 45 to 60 days to implement this with an employer, we're going to capture all the people that can utilize this program, and we're going to remove the vast majority of the prescription expense from the plan. Your employer, your client will realize incredible savings, and you'll help the employees save on their copay, and they will be thankful that you're in this program. We've got a couple quotes down here. We'll send these to you, the slides to you if you're interested in them. The bottom line is we've proven this works, and I think when you walk in the door to open up a large case opportunity, you will be blown away at the numbers. We've got a zero access fee. You can look at the left side of this. Many clients get their prescriptions at no cost, and when I say clients, I mean the employees. Others will receive their prescriptions at 75 to 90% off. And we're talking about expensive name brand meds. We're talking about high-cost specialty meds, high-cost generics. Nearly every day I get an email from a broker with a client that's got an employee on a high-cost specialty med. It might be $100,000, $200,000 a year. And typically we're able to get that drug off the plan, and the employer's liability for that drug goes away altogether. We also have an opportunity to combine this with telemedicine. It is not a requirement in the program, but if you want to use the telemedicine as another way to reduce office visit expenses in that employer plan, this is an opportunity as well. We've got some historical data to show you the number of drugs that we can get access to. This is not in any way meant to be exhaustive. It's a list of drugs we've already helped employees get off of their medical plan and through our advocacy group. And we've built a low PEPM, so you can build in a PEPM into the program and make a substantial amount of revenue. The list of these 10 drugs on the right-hand side of the page illustrates a client that had 10 high-cost meds that were $1.5 million a year of cost to the medical plan. We got all these drugs except for the Lantus at no cost, and the Lantus costs $555 a month, a little over $6,000 a year instead of $1.5 million. That's $1,500,000 of savings. We need a data template filled out. If we get the RX data from the PBM, we can do some analytics on the most recent 12 months and illustrate the cost savings potential that's available. So if you want to get us a quote, we'll send you the template, get the template from the PBM, and we can put the numbers together. So you request that RX data template. We need you to verify the number of covered employees. Send that data to us at Shared Health Alliance. We'll get this quote put together. You'll be blown away. Your employer and your prospects will be blown away. If you've got a case that you have competition this year and you can eliminate lasers by getting a high-cost drug off the plan, or you can eliminate 60 to 80% of the drug spend, it's very unlikely you wouldn't win that prospect. I appreciate your time, guys. I want to be respectful of it. Give me a call. Shoot us an email. I'm telling you, you look at this once and you'll be shaking your head saying this is an amazing way to approach the prescription spend within an employer group. Talk to you soon. Have a great day, guys.